My name is Uche Davidson. I'm a spine surgeon at Texas Back Institute. I was born and raised in Nigeria. I moved at a young age of 16 to Canada, where I would do high school and college. Played a little bit of college soccer in Canada. Unfortunately, had a few ACL injuries and quickly decided that maybe I should pursue my academic interest. I was fortunate to get a scholarship to go to the Cleveland Clinic, where I completed 5 years of medical school. Fell in love with the city, decided to stay an additional 5 years. So I spent a total of 10 years in medical school and residency, completing my orthopedic training at the Cleveland Clinic. The last year I spent at Emory University, completing my spine fellowship to be a spine dedicated surgeon. Outside of all my academic interests, I love to play soccer. I played competitively in college. I don't anymore because of the ACL injuries, but I still like to get out there and play. Occasionally pick up soccer with the guys and ladies and just have fun. I'm a new cyclist. I say that with caution because I'm yet to complete any of the extraordinary kind of like long distance races. But I do enjoy getting out there, being out there in the weather and just exercising. I'm family oriented. I'm the first of three. I love to spend time with family, my fiance. A typical Saturday afternoon is spending time at home, hanging out with the family, and I love to cook and trying different dishes. I decided to become a doctor because I, from a very young age, wanted to help people. I loved biology, I loved the sciences. I was inspired by my granddad. He was the first pharmacist in the region. He had spent time in the United States and come back home, I want to say in the 1960s, 1950s. So having such legacy of a grandparent that was a pioneer in the field kind of motivated me. Although my parents were teachers and no one was in medicine, but I wanted to aspire to do something unique and different. I loved being able to do things with my hands. That in combination with trying to help people kind of stared me down the biological sciences. I think what I really enjoy about spine is really tailoring what you do for patients that is totally different. There's numerous ways to kind of address the problem, and I think that encourages and stimulates my creative instinct. That with my combination of helping people and using my hands just made spine surgery the perfect combination for what I want to do. I want every patient that I encounter to feel like they are part of my family. I want to make sure that we provide a positive outlook for whatever reasons that they are here, whether it be conservative care, whether it be minimal invasive or advanced degenerative care. I just want to make sure that they know I'm on their team, I'm on their side. My goal is to provide them the care and the help they need. And I just want to make sure that every time that I can, that they leave our practice or they leave our care understanding that we truly cared about them and in one form or shape help them alleviate their disability. So I truly want my patients to know they're part of my team and I'm part of their team, and it's a collaboration. Texas Back is a great institution with a great reputation. I've always wanted to marry my experience and training in academia and also be able to serve my community. I think Texas Back provides that unique situation where I'm in the community helping my patients, but the opportunities for me to stay innovative, to stay creative, to continue to pursue my academic interest. That combination and being home in Dallas, my second home, those were certainly, this is a dream job for me, and I'm glad to be part of this team. I want to give back. I've been fortunate to have transcended multiple environments, countries, continents, you name it. I've lived in different places and different times, and I want to leave spine in better hands. I feel like there is an opportunity to train the next generation. There's an opportunity to impact my community. I want to leave spine in a better place than I met it. I want to make sure there are many offsprings and offshoots of quality, ethical, and moral spine care, and I want to be the face of that, and I want to leave a legacy of that. I want to make sure that I just didn't take all of this training, and I wanted to make sure I get back. And that is part of why I'm excited about the partnership with Texas Back, the opportunity to be part of fellowship training in the future and be able to impact the next generation of thoughtful leaders in spine.